Welcome all. Are you running a video?
Yes, it's all
Okay.
recording. We can start. Welcome,
Okay. So we
everyone.
can start. Thank you very much. So good. Welcome, colleagues. Today is an exciting day because we are looking to the launch of our 2024 UHC Day campaign. You remember that UHC 2030, together with the Coalition of Partnership for UHC, is really interested in driving forward the agenda of UHC together, and that is why we formed this coalition of partnerships for UHC and global health. So we have multiple partners here that you're going to see, not only UHC 2030, but of course the Partnership for Maternal, Newborn, and Child Health (PMNCH), of which I'm proud to also be part of, the RBM Partnership for Malaria, UNAIDS, the NCD Alliance, because we realize that the agenda for UHC is not a vertical agenda, it's not a horizontal agenda, it's actually a diagonal agenda. It's everything together to ensure healthy lives for everybody. And as you know, in December, we have the UHC Day. So today is the launch for that day, for that campaign. And there will be, the team will be sharing the toolkit, the campaign material, so that you see how exciting this is. And this is important because we are all drivers of this advocacy agenda to ensure that wherever we are in our countries, in our communities, that governments put policies and action in place to ensure that people do not continue to get poor out of health costs. We know, for example, that in the UHC Global Monitoring Report, we were told that whereas access to services is increasing, it is increasing at the cost of household income. So the question is, how do we ensure that we drive action that makes sure that governments reduce financial burden for access to health services, and ensure that communities are at the center of this as the seventh building block, in addition to the sixth that WHO has defined, because the community is actually the most important building block to health. So today we are going to have a panel. We are going to have some opening remarks at some point. And please, team, when Magda does join, let me know. But for now, we are going to move forward and make sure that when the panel comes, you post your questions on Q&A so that we can have this answered. So we will then proceed to a short video, because I know we are over time, so we'll not keep this too long. We will then move to a short video, which is going to be run on the 2024 UHC Day campaign. So Nina, please, could we see the video, and then we'll call upon the panelists. But welcome everybody, and feel at home, even virtually.
Thank you so much, Gitinji. I think before I show the video, Pamela has some remarks that she's going to step in for Magda. So I'll give the floor to Pam, and then we'll move back to me. Thank you.
Fantastic. Pamela, over to you. Thank you for stepping in for Magda.
Okay, great. Certainly. I'm sure she'll be joining us shortly. Again, thank you, Gitinji, for all that you do for us and for this cause. I'm Pam Cipriano, one of the co-chairs of the UHC 2030 Steering Committee. And it's my pleasure to also welcome everyone to today's launch of 2024 UHC Day campaign, which really is focusing on financial protection. We care about all the goals of UHC, but this is one that we really believe is important to highlight. According to the most recent WHO estimate, we still are having 4.5 billion people, more than half of the world's population, lacking access to essential health services. We also know that nearly 2 billion people are experiencing financial hardship in accessing services because they have to pay out-of-pocket expenses, which is creating tremendous hardship. Over the past 2 decades, financial protection has progressively deteriorated in 70% of our countries. This really has to change, and we need greater financial protection as a priority alongside greater access to services. We know we can't have progress towards universal health coverage if billions of people are pushed further into poverty or decide to forego or delay medical treatment, which can result in more long-term sickness. When governments invest in UHC and protect people from impoverishing costs of healthcare, they also drive significant economic and social benefits. No one should have to choose between essential care and their other essential needs like food and education. We know for each of us, life expectancy has improved. GDP rises nearly 4% when we have significant economic and social investment. For every $1 invested, the return is $9. By investing in publicly funded financial protection schemes that guarantees everyone has access to a set of essential services, governments actually avoid short, medium, and long-term costs in healthcare spending. They reduce welfare losses, increase household savings, and overall economic prosperity. So it is the smart thing to do. Reducing and eliminating out-of-pocket payments for healthcare leads to healthier children as well, who perform better in school, and it increases gender equality by ensuring women and girls can access the health services they need. It also increases worker productivity and reduces health-related poverty. Now, we still have 6 years to go before we reach the Sustainable Development Agenda's 2030 target. Making progress on UHC is possible in the time we have left. We do have to catch up, though. At the global level, it will require restructuring of international financing to ensure all governments struggling with difficult budget choices have the support they need to realize people's right to health. At the national level, it requires urgent action by governments to turn the commitments they made at the UN high-level meetings on UHC in 2019 and 2023 into laws, policies, programs, and budgets. So that's where this year's UHC Day campaign theme comes in. Health, it's on the government. It's our collective reminder to governments that UHC and financial protection for health really is their responsibility. In conclusion, we hope that as UHC and SDG advocates, you will also be inspired to join us in spreading awareness and mobilizing governments and decision makers to protect people from impoverishing effects of healthcare. We can do so by reminding them of the benefits of financial protection for communities and the economy. From now through UHC Day on December 12th and beyond, we encourage you to be an advocate for UHC so that by 2030, everyone, everywhere is protected from impoverishing health costs and can access the quality health services they need when they need them. I'll now give the floor back to our moderator, Gitinji, but first, let's watch a short video introduction to this year's campaign theme.
Thank you very much, Pamela. And we may watch the video. And as the video comes up, I want to say health is on the government, and government needs to show love to their people. And the way to show love is through budgets. Thank you. Let's watch the video.
Accessing essential health services should never push people into poverty. Affordable health services save lives. And when populations are healthy, communities and economies thrive. It's time for governments to protect people from financial hardship when accessing healthcare.
Wow, that's short and impactful. Thank you very much. Pamela, any comment on that video before you go?
I think it just underscores the role for all of us to truly be advocates, because financial protection is the area that we're most far behind on achieving UHC. So we really look forward to everyone's engagement. Thanks.
Thank you very much, Pamela. And underscoring there that health investment is actually economic investment, that when people are healthy, economies thrive. And therefore, government need to see health investments as economic investments. Thank you very much. And I see Magda has joined. So I think I'll leave it between the co-chairs to agree how to handle, because Pamela was supposed to come back for the closing remarks. So I will leave that consultation between the two of you, and I will proceed here. Is that okay, Pamela? Yes. Okay, you're on mute. I couldn't hear you, but I guess we agreed that we'll see then.
Yes.
Yes, good. So
yes, I will confer with Magda. Thanks.
Thank you. Thank you. And welcome, Magda. So we will now move on to an exciting panel that is going to kind of explore the different roles of the different partnerships, starting to look at what is it that people are experiencing from their different vantage points. The panelists we are going to have include Rajat Khosla. We are going to, of course, the PMNCH Executive Director, Michael Adenkule Charles, with the CEO of RBM. We will also hear from Angeli, Deputy Executive Director for the Program Branch, UNAID. And we'll hear also from Alison Cox from NCD Alliance. Alison is the Policy and Advocacy Director. and then we'll get questions from each of you. So first and foremost, I would like to ask that the contribution by Rajat is going to be on video. So I'll ask that we hear from Rajat on video. Thank you. Please run Rajat's video, then we'll go to the other partners. Thank you.
Greetings from the Partnership of Maternal, Newborn and Child Health. My name is Rajat Khosla and I work as the Executive Director of the PMNCH. Colleagues, financial protection plays a crucial role in improving healthcare access for key populations such as children, adolescents and women, and in realizing their right to health. By reducing the out-of-pocket costs that often create barriers to accessing essential services, financial protection ensures that these vulnerable groups can seek timely and appropriate care without facing catastrophic expenses. For children and adolescents, financial protection can facilitate access to vaccination, routine checkups, and treatment for common diseases, which are critical for their long-term development and well-being. For women especially, those of reproductive age, it helps secure essential services like prenatal and postnatal care, family planning, and treatment for maternal health conditions which directly impact their health and the health of their children. By reducing financial burden, especially for low-income families, financial protection can also reduce health disparities, ensuring that economic costs do not dictate the quality of care received. This ultimately strengthens health systems by fostering universal health coverage, ensuring that everyone, regardless of their financial means, can access the health care they need. In this way, financial protection directly upholds the right to health, ensuring equity, access, and dignity for all. Thank you.
Thank you very much, Rajat, for that video underscoring the importance of investment in UHC. And to all of your colleagues, I can see you posting where you are from, where you're coming from. Please keep posting. We know who is joining us today. It's an exciting time launching our campaign for UHC Day for 2024. And I will now move on to a quick round of conversations. And please remember to post your questions to the panelists as we go along. So I'll move on to the first question is going to actually be for RBM, the Rollback Malaria Partnership. And we have said that the financial difficulty reduces access to services. So when you lift financial difficulty and you do financial protection of communities, then services become easier and you have better health. There's no better place to explore this conversation than on malaria, because through the investments that have been made, we have lifted largely financial burden for communities from accessing malaria services. So I would like to ask, Charles to comment on this issue and say, so what is the experience that you've had, Michael, on reduction, the impact of reducing financial barriers on the access to malaria services and products? What impact has that had, and how would that apply to other services if we were to lift the financial burden on other services as well? So over to you, Michael.
Thank you very much, Gitinji, and welcome to our participants and fellow panelists. Allow me to speak from a personal perspective and then a professional perspective. I've had the privilege of working in settings where financial protection was there, and I've also had the privilege of working in settings where financial protection wasn't there. And it was like day and night, because where financial protection was, we could see that patients came to the clinic early, they were treated early, and they could go home with even less resources that the hospital is spending because they came on time and they came early. In other settings where financial protection wasn't there, in the worst case scenario, we would see mothers carrying babies that were almost given up. And that was how drastic it was in terms of the difference. Now, when we take it more to the malaria world, since the year 2000, there has been a concerted effort to ensure that malaria commodities are given by and large free of charge. through contributions from the Global Fund and through contributions of others. We've been able to distribute nets, distribute medications, distribute rapid diagnostic tests. And through that, we've been able to see that since the year 2000, we've been able to avert over 2.1 billion cases and also avert almost 11.7 million deaths. I think this is really significant in terms of the contribution that the global partners, including countries, have played in terms of ensuring that commodities can be given for free. And these services are also linked to other services. The EPI, the immunization services, for example, we encourage mothers to come for their immunization, which is partly free, but then they're also given a net as an example. And again, this is where we can see the intersection with other areas as well. So the more we can do it, not just for children, the more we can do it for the entire population, the better. So, the encouragement is financial protection is key, as you rightly said, towards economic development, towards development of girls, of women, towards education. It is really important, and countries that are embracing this are really better off than countries that are not.
Excellent. Thank you so much, Michael. And I think that is very clear in terms of life saved by, and also making it easy for communities so that a mother doesn't have to worry about, so my child has a fever and I have only $2. Do I choose food or do I choose to take the child for services? And often when there's no money, they'll choose food, because that is actually, until it's an emergency, they will choose food over going to seek services. By removing financial burden, then you make it easy for the demand of health services for better health. Thank you for that, and the work that's going on in elimination of malaria and the role of RBM in that. Now, let me come to Anjali, Deputy Executive Director for the program for UNAIDS, for the program branch of UNAIDS. And I think the question is almost related. So, Anjali, my question would be, how is universal health coverage, an achievement of it or not, helping to strengthen the response to HIV/AIDS at country level and address any gaps that you find in integration of prevention and treatment in essential health services packages? Like, for example, countries are working on packages for UHC. Are you seeing integration of HIV prevention and treatment in these packages when they are being created by governments? And how is financial protection, how are the financial protection measures following that to ensure that you have better access to these prevention and also treatment services? Over to you, Anjali.
Great. Thanks so much, Githinji. And thanks, everyone. It's really wonderful to be with you today and really be here at a midpoint related to the SDG targets for health and beyond. As Michael just described, and Githinji, as you did and Pam did in the opening, UHC, health security, ending ongoing pandemics. We heard about malaria. I'll be speaking about HIV, TB, et cetera. They're all common and intersecting goals. And it's really not to pit one disease against the other, but really to be thinking about a diagonal approach. UHC, for us engaged in the global HIV/AIDS response, is not only about the availability of health services, health technologies, and commodities, but also ensuring access to those is equitable without barriers such as poverty, stigma and discrimination, gender inequality, and other human rights practices. So we're really talking about health being more than just health and within the health sector's mandate. And this is a critical approach that we've learned in the HIV/AIDS response over the past 30, 40 years. Financial protections in the HIV response, whether it be ARVs becoming accessible or integrating services for people, has been life-saving. It's been game-changing. But this should not be the exception. It should be the rule. UHC is also about ensuring that people across the life course get supports wherever and to whomever, and from whomever rather they prefer, including from outside health facilities in their own and from their own communities. That's one thing that I would like to mention that we've really learned in the HIV response, that community empowerment, meaningful community engagement, including in delivering services from beyond the formal workforce, has been critical and will be critical for UHC as well. We must also collectively push for synergies across health agendas and integrated approaches so that there truly are health rights for all. We can't afford to pit one disease against the other or health system strengthening against disease siloed approaches like Githinji, you mentioned earlier. It really is, we need to focus on the diagonal. So when services, systems, and policies for health are integrated, HIV and other health services can improve health outcomes, strengthen and sustain health systems and programs, and support progress toward UHC. We've seen this time and time again from the HIV response. The HIV response has, yes, delivered on HIV outcomes, but it's also given so much more that countries can use to respond to other pandemics, for example, like Mpox or COVID, or TB and HIV, other integrated services, but so much more. So ending AIDS and achieving UHC is an opportunity to really uniquely bring leaders together for shared responsibility across governments, communities, development partners, private sector, and more. You know, we're still in the HIV/AIDS response, even though we've seen tremendous progress. AIDS still claims a life every minute. Last year, we had 1.3 million new HIV infections. This is unacceptable. So we have to continue to drive down these new infections in HIV while we have our eye toward how we can ensure more people-centered care through UHC. You know, of the 60 countries that have adopted UHC schemes, only 38 include antiretroviral therapy for HIV treatment, and 21 include antiretroviral PrEP, or pre-exposure prophylaxis, for HIV prevention. So there's a lot more work that we have to do to better integrate these services into UHC. So the final thing I'll just note is that, you know, it's an opportunity. I'm so excited about the campaign that we're launching together. I think this is an opportunity where together we can really hold ourselves, governments, other stakeholders and partners to account. We have to really work together to both finish the disease-specific efforts while having our eye toward building a stronger UHC system that serves everyone everywhere and that really focuses on people-centered care. So there's a really important opportunity right now, and we're really excited to be a part of this partnership. Thanks so much.
Thank you very much, Njeli, and for making that submission, and also reflecting that basically as you're speaking, I was thinking health systems are actually disease agnostic. Health systems need to be able to be neutral to the needs of the people, and they need to be disease agnostic. And I think that is why this coalition was formed, to say it's not either or, because initially, as you have heard from the contributions here, and we are going to hear from NCD Alliance as well, there was this thing of feeling of, you know, is UHC now competing for money that would have gone to NCDs? Is UHC now competing for money that would have gone to malaria or HIV or maternal and child health? And then there's the realization that actually, if we build a common health system, all our goals will be achieved. So this is the approach here, and thanks for those contributions. And now I want to ask Alison to comment on this issue of, and there's a question for you, Alison. So as I had the question on youth engagement, I want to ask you to comment on the issue, the same issue that has been commented on by the other colleagues. What, you know, do policymakers that are in the area of, that need to make policies and deliver on UHC, what do they need to include in their budget, their policies, their programs to address the issues of financial barriers to people who are living with NCDs, who actually, as I know, bear the biggest burden of out-of-pocket expenditure? What is your ask from an NCD Alliance point of view to policymakers on those issues? Over to you, Alison.
Oh, thank you so much for the question, and hello, everyone. It's really great to be part of this campaign launch today on this really key issue of government investment in universal health coverage. Nearly 1/2 of the global population is living with a non-communicable disease like diabetes, cancer, heart disease, mental health, or neurological conditions. So if we're going to talk about universal health coverage, NCDs really needs to be right in the heart of that conversation. And as you say, they are a drain on households and economies everywhere, cutting lives short and destroying livelihoods. The burden is especially destructive in low-resource countries. 82% of NCD deaths before the age of 70 are occurring in low and lower middle-income countries. And as you were just saying, our own research report on out-of-pocket costs last year, called Paying the Price, showed that the most marginalised communities are the ones most at risk of being left behind by health systems in countries of all income levels, and shows that globally, out-of-pocket spending for NCDs is estimated, unfortunately, to be twice as high per visit to a health facility than for infectious diseases. So to protect people from catastrophic spending, which is at the heart of the campaign, countries need to include NCD prevention, diagnosis and care in the health benefit packages and in the national health insurance and social protection schemes. And we know there are tried and trusted interventions that will save lives and money. The WHO has produced what are called the best buys, showcasing the most effective NCD interventions that are affordable to all countries and guarantee a big return. There are a set now of 28 NCD interventions focusing on prevention by addressing four of the major risk factors: tobacco, alcohol, and healthy diets and inadequate physical activity, along with the management of cardiovascular disease, diabetes, chronic respiratory disease, and cervical cancer. An earlier WHO investment case report on the best buys calculated a return on investment of $7 for every $1 spent on this package. More recently, a 2021 analysis of that was fully aligned with the best buys looked at a package of 21 interventions that showed by implementing locally tailored packages over a period of 7 years up to 2030 could avert 39 million deaths in low and middle income countries and provide economic benefits that outweigh costs by 19 to 1. So these are evidence-based and cost-effective packages. And crucially, I should say, a number of these interventions on the prevention side include increasing excise taxes on health-harming products like tobacco and alcohol and unhealthy foods. So they don't only reduce health service costs, but they also provide government revenue. There's also other cost-effective and globally applicable packages put together on specific topics like heart, shake, replace, pen, and pen plus. And they've been developed with partner coalitions to guide and accelerate investments to support governments. PEN, for instance, focuses on providing early detection and management of various NCDs in primary healthcare settings, ensuring accessible, cost-effective care for conditions like hypertension, diabetes, and chronic respiratory diseases. So just to say, we have a roadmap for investment in NCDs. We know how to protect people from financial catastrophe due to out-of-pocket spending. So what we need now, and as the campaign says, is for leaders to take action and speed up the implementation of these policies and interventions.
Excellent. Thank you very much. And now, I'm reminded that when governments are planning their health budgets, one of the biggest risks in their health financing strategy is NCDs, because they often do not see the future track coming to crash. And if they don't invest now, then they're going to have to pay the cost in future, which then affects how they invest in the UHC. So thank you very much, Alison, for those comments. And as we come to the end of this panel section, and Alison, there was a question for you. Maybe I could just ask you to respond to that, about what you see as the role of young people in this response.
Yeah, young people are really important in highlighting the unhealthy environment that we're in. They can really show a leadership role in speaking about the unhealthy environment, commercial determinants of health, and marketing of unhealthy products, and run strong campaigns on these. They also can be strong voices of people with lived experience. So yeah, the voice of both young people and people with lived experiences and community voices are so important to both pushing for and showing demand for the policies, but also then informing their development and implementation.
Thank you very much. So as we close this now, I just want to hear from each one of you. Of course, we can't ask Rajat because he's not here. He was on video. But for each one of you, if you had one wish to policymakers and decision makers, what is it you'd wish for that would make sure that everyone everywhere is protected from catastrophic health expenditure? One wish in 3 seconds. It can't be more than that. Just one wish. What is it? I'll actually start with you, Alison, because you're the one I see on my screen because you spoke last. Then I'll move backwards to Anjali and Michael. Over to you, Alison.
Right. Well, it builds on what I was just saying. I wish that policymakers recognise health as an investment, not a cost. It's an investment in their economy, it's an investment in population well-being, and it's an investment in the success of their government. So we know what they need to do. They need to show that leadership and deliver.
Excellent. Health is an investment. And I think this message should be carried forward to the UHC campaign that you're going to do in your country. Health is an investment. Anjali.
Yes, Alison took the words out of my mouth. I was going to say recognition that health is wealth. Full stop.
Health is wealth. Health is wealth because health is related to economic growth. People have lived better lives when they're healthier. Thank you, Anjali. And finally, Michael.
Great. Just to follow in the same suit around financing. If I had a wish or a statement, it would be, we have to spend money to save money. The investment we make in health, we will reap it in 1,000 folds throughout the world. So spending money to save money would be my closing remarks.
Great. Thank you so much. Again, Michael, reflecting on exactly the same, that we invest now, we reap in future. So I think we are seeing that the investments made, for example, in malaria, HIV, and TB, are actually paying off big time. So there's already an investment case showing up here when you invest. Because if we didn't invest, health systems would have collapsed through HIV, for example, malaria and tuberculosis. But we've invested and reduced the burden on the health system and on communities significantly. So we should invest the health system as a disease neutral, disease agnostic, invest in it so that in all these diseases, we achieve, healthy communities, which is really what we are all looking to do. So I wish to thank our panelists for such great contributions that also enrich how we move forward to the 2024 UHC Day campaign. So there are questions coming, and I think keep putting the questions on. I will summarize them, and maybe we have time at the end. I'll ask the panelists. For now, I would like to hand over to Paloma to lead us through a presentation of how the UHC Day campaign materials look like. So Paloma, over to you for now.
Thank you, Gitinji, and thank you to the Coalition of Partnerships for co-hosting this campaign launch and for this important discussion on the benefits of and the critical need for financial protection for health. I'm Paloma de la Cruz. I'm a communication consultant with UHC 2030, and I'm excited to be here today to share this year's UHC Day resources to support your campaign. Before I jump into the toolkit, though, I want to take a second to acknowledge a few of the people behind the scenes. So every year, to prepare the UHC Day messaging, the materials, and the campaign components, UHC 2030 convenes a multi-stakeholder coordination group comprised of parliamentarians, representatives from national and local governments, health-related partnerships, civil society, philanthropic foundations, the private sector, academia, think tanks, and youth. So I just want to extend a huge thanks to this year's UHC Day coordination group for their work and their contributions. Your inputs have been instrumental in making this year's campaign materials as clear, relevant, inclusive, and user-friendly as possible. So thank you, and we look forward to our continued collaboration. I also want to thank Stone and Seed for their support with this year's messaging. and the microsite updates, and for developing the beautiful visuals that I'm about to share with you. I'm going to share my screen now. Hopefully everybody can see my screen.
Very well. Thanks, Padma.
Great. Thank you for confirming, Laura. So the UHC microsite is your entry point into this year's campaign materials and tools. So I thought I'd just walk you through it tab by tab, although I'll be spending most of my time on the toolkit itself. Here we're on the homepage, which provides some background on the commitments made to UHC in the global context, while highlighting the benefits of investing in UHC and financial protection. And you have the key campaign graphic that you saw at the beginning of the call with the video. You also have a countdown to UHC Day. As you can see, it's not that far away, and the video that we saw. There's an about page, which I invite you to refer back to once we finish this call. It just provides some general background about UHC, UHC Day, and UHC and the SDGs. And then for me, the most exciting part, the toolkit for campaigners. So these are the materials developed for you, for UHC and SDG advocates around the world, to help you lead your campaigns in your locations and with your organizations. The overarching campaign graphic is presented at the top with a little blurb explaining what we mean by health. It's on the government. As Pam mentioned in opening remarks, this is our reminder to governments that financial protection for health is their responsibility. You have underneath this main campaign graphic 3 tweets. These are suggested tweets. You can click on the button and modify them, modify the images, or you can draft your own. So for this and for all of the other materials I'll be sharing, think of it as a starting point for you to then create your own materials and messaging around financial protection. Underneath this key graphic, we have 2 advocacy messages. Healthcare should never push people into poverty, and universal health coverage is good for people and the economy. So once again, we have the key graphic, or the graphic that corresponds to the message, a little blurb explaining the message, and then a suggested tweet that you can modify or post as in. And we have a tweet to post button, but you can of course copy paste this and use broadly on any social media networks that you're working with. And underneath these advocacy messages, we have the key asks for decision makers. So we have very concrete asks that governments, things that governments can do to make progress on financial protection and on ensuring that people are not pushed into poverty or further into poverty due to health costs. So we have these 5 images that you can see in this carousel. You can either post the carousel as is, with one of these suggested messages, or depending on your priorities, you can use the images separately. You might stagger them throughout the campaign. Again, these are tools for you to use as you see fit, and we're here to support you in any way necessary. And because we want to help you make this campaign your own, there's a section, Customize Your UHC Day. We'll be building on this over the next few weeks. For now, we have the logos, but we also plan to add by next week a template that will allow you to swap out the icons in the silhouette and to change the message. So you can choose what icons you want to feature based on the specific messaging you want to emphasize. You can modify the message and still keep the same cohesive look. Yeah, and so we're looking forward to seeing what you make of these. Please stay tuned on this. There will be other resources as well over the coming weeks, so please keep coming back to this page to access the latest. And then the last section is Mobilize Your Government. This is a link to a very important resource, the advocacy letter template. So we invite you to click on this to get simple step-by-step instructions on how to write an advocacy letter with a template that's available in multiple languages. We also encourage you to attend our workshops. There's a workshop coming up on the 17th of October, tailored for youth, on how to write an advocacy letter for their specific context. So yes, we hope you'll find this useful, and we'll continue to have events to help advocates write to their decision makers and ensure that the change that we need to see happens on the ground. These are the main components of the toolkit page. You'll find additional resources on the resources tab, including the election advocacy guide, which you may have heard of, and the state of UHC commitment. And then one key resource or key components of the campaign is this global campaign tab. So here you have a short form that allows you to fill out the information about your campaign. So whether it's a virtual event, an in-person event, a social media campaign, an announcement or a publication, we strongly encourage you to fill out this form to promote that so that we can then add it to our global heat map. This will not only give you and your event visibility, it will also allow campaigners in your area to engage with and participate in your event. And it'll allow us to show the span, the breadth of the UHC movement. And finally, we have the impact tab, which provides links to previous campaigns and a bit of history about UHC Day. So I realized that was a lot of information in a very short amount of time. We're here to support you, so please drop your questions in the Q&A box, but also feel free to email us at any point if you have questions once you start working on your campaign. We also encourage you to sign up for UHC Day updates on Substack. There's a link at the bottom of this of the microsite in the footer. We will be using the Substack this year to share step-by-step instructions on how to prepare a campaign. So there will be eight issues between next week and UHC Day, really walking you through how to prepare your campaign and linking to relevant resources from the toolkit. So we hope you'll find that useful. Please remember to sign up, and we're looking forward to seeing and engaging with your campaigns. Thank you for everything that you do.
Thank you so much, Paloma, for that. An excellent toolkit. And the background on Zoom is also part of this toolkit, and I love it. It's beautiful, actually. It makes me be a little more photogenic than I've been before. So thank you. Now, we have seen there are several questions, but I think before we go to the questions, I would like to invite Hayat Kosa, the Regional External Relations Director of the IPPF and a member of the UHC 2030 Civil Engagement Mechanism Advisory Group, to comment on the CSO perspective for this campaign theme. Over to you, Hayat.
Thank you so much, and really so happy to be here, and really so happy that we are finally talking about financial protection. You know, one thought that is on top of my head right now is that communities, especially coming from the global south, we are one step away, and that one step is one medical bill away from poverty. You know, that is why we need financial protection. As you know, Rajat started talking about women, we need universal health care. We need to reach out to women, because we all know that in any household, women, a lady is the last person to access healthcare. We are not even talking about nutrition here. We are talking about health services, reaching out to the services, accessing them. That is the level. We need UHC so that there's a universal access to sexual reproductive health rights and justice. And to strengthen that, the last push, I think, is the financial protection. Also, this is 2024, but let's not forget 2020, you know, because what COVID taught us, one thing, what COVID made us realize that we pushed communities who are on the margins much beyond the margins also. There was no healthcare available for, you know, women in diversities, for LGBT communities, for women in sex work, or people in sex work, or even young people had difficulty in accessing. I want to share my personal story here. When COVID came, especially during the second wave, you know, I got it in the second wave, and I lived in a medical college because my partner worked there. Emergency room in that government medical college was in front of my house, but I could not get a bed. I could not get an oxygen cylinder, and it still haunts me. It was like I was thinking, oh my God, I'm gone. But I could not get anything in private sector. And I was much aware. I knew where to go and do. This is what, you know, haunts me till date. And I think as CSOs, as health systems, we are bouncing back. I still have faith. And we need to make our health systems more resilient. We need to make sure that we are able to, reach that last mile, get healthcare in hands of communities, those who need it the most. As civil society advocates, as community health and human rights, advocate, I think we need to push for political commitments. We need to urge our parliamentarians, our leaders, our politicians to push for financial, protection. Thank you so much, Paloma. I just love the toolkit. It is so nice, so crisp, and it is so to the time. Young people are going to love it. That I know for sure. So I'm very happy about the toolkit. Let's use these tools. Let's advocate in a unified voice, so that when we are reaching out to communities, we are reaching out to politicians, we are pushing our agenda. We are pushing for financial protection. There are other tools also as CSCM that we have been advocating for, and we are building our communications, our agenda on that. Social protection. Let's talk about it. And how do we reach out to that? There are new and innovative methods that we need to capitalize on. Digital health intervention, self-care. I think high time. Let's get all our forces together. And as IPPF, coming from CSCM, my commitment is that we are able to reach out to communities, especially women in all diversities. And when I'm talking about women in sex work, women who use drugs, women living with HIV. Thank you, Anjali. I really think that, HIV has not gone. We need to bring our forces together. We need to reach out to young people, So let's do that. Let's reach out to the communities who are pushed to the margins, and then only. And one tool that I think that is amazing, that our message is financial protection. So thank you so much. Yeah.
Thank you very much, Ayot. And for those remarks, full support of the civil society engagement mechanism, the CSO perspective, really critical. And we have a few questions, and I know we don't have much time. So what I'm going to ask, I'm going to mention what the key highlights of the question, but I'm going to request the panelists, each of you who's spoken, go to the Q&A section. If you see a question that's directed to you, please answer it. But in the meantime, I want to give each of you, because we have only, if I estimate, 5 minutes remaining, and I don't like going over time for people, because people have other activities to do. But I'll just mention where the main questions are, and then I'll ask each of the panelists to respond in 1 minute. Just pick whatever it is that you want to comment on, but don't go above a minute. So the questions are largely about the impact of the debt burden on the affordability, the fiscal space of countries, with reference to Malawi. If the debt burden is so huge, how do these countries afford UHC? There's a question around country level and advocacy at country level. What are the challenges of that at country level? And I think that was actually directed to you, Ayot. Then there is a question around corruption and greed, and how that affects the government priority for investing. So we have, and then the other question is around, specific diseases that are neglected or ignored. For example, the hereditary blood disorders. How do we make sure they are part of the UHC agenda, so they're not left out of this equation? And finally, old people and their rights. How do we account for that so that they are not left out, because they are often the most disadvantaged? And finally, the question of ensuring that patient safety is incorporated. So the questions are around these key areas. So you can pick any, but just make it brief, to the point. Over to you, and I'm going to start with you, Michael.
Great. If I take debt burden, UHC shouldn't be seen from a country perspective alone. I think we're all in this together as the entire world. So UHC and what we're trying to do within the malaria space is really work with countries, work with the World Bank, Islamic Development Bank, to see how some of these debts can be restructured, or whether there could be debt relief, so that the countries can use the money that they are meant to use to pay back the debts to really invest. So that's one way, I think. In terms of greed of our leaders, I think this is what we're saying, and this is why we need the youth because the youth are vibrant. We really need to make sure that when we're electing our leaders, we elect wisely and we elect people that will be accountable or that will be held accountable. I'll stop at that in the interest of time.
Thank you very much, Michael. Anjali, what will be your closing remark based on these areas?
Thanks, Githinji. Maybe I'll just focus a little bit on, I agree with what Michael responded and very similar from the HIV response, but maybe I'll take the aging population as it relates to the HIV response. For example, we have people living with HIV. It's a success story, but it's also a challenge of ours. People living with HIV that are aging and now getting older, and what we want to make sure is that chronic diseases that they're confronted with, we're able to protect them against that as well. So UHC is the answer for this. So it's something that we have to continue. It gets back to the diagonal, Githinji. We have to continue to work along that line because we're thinking about the aging population of people living with HIV. So again, the work that we need to do together on ensuring rights for both the young populations, but also the aging populations is critical. Thanks.
Thank you very much, Anjali. And Alison?
Thank you. Yeah, absolutely supporting that point about an integrated approach across the life course is absolutely central. You talked about health services being agnostic. They need to be patient-centric and responding to patient needs, not to verticals and funding streams. So very much supportive of looking at the primary healthcare model as an entry into this and investment in that. And just on the financing side, there are a range of different places where the money can come from, there's no one solution. So certainly domestic resource mobilizations, governments investing in health, allocating more budget money and looking at how they can best do that. The need for catalytic funding to support that from international funding sources in lower income settings. Private-public partnerships can also play a role, along with innovative financing. So we all need to look across a range of options, but it starts with domestic resource mobilization and it starts with governments prioritizing health.
Great. Thank you very much, Alison. And I can see people are adding comments to your responses. They're being appreciated and they're adding more. And finally, Hayat, would you like to comment?
Yes. So I want to push or add more emphasis to the point that we need to have one voice. Why we have these toolkits, make the most of it, have a unified agenda. We need to build more on communities' intelligence. When we are conversing or when we are reaching out to parliamentarians and politicians, there is a varied, there is so much happening. War economics have shaken us. How do we build on it? How do we support communities from humanitarian and fragile settings? Let's not even think about it, So there are unique needs of communities. However, we need to build our agenda, which is inclusive but diverse in nature, and bring it all together and then talk to our governments where UHC is there and then advocate that we need to expand, we need to be strengthened, we need social protection. So we need financial protection. Yeah, thank you.
Thank you very, very much. And because we are coming to an end now, I just, Paloma, there was a question on the tools. I think you've already answered that in your excellent presentation. So I don't know whether you want to add anything or that's enough. Anything you want to add, Paloma?
Well, I saw a question about the whether it's okay to use the resources already. Yes, please go ahead. These tools are all available on the website now, uhcday.org or universalhealthcoverageday.org. Please use them broadly. Please add your own messages. And then just a reminder that more tools are coming. So in addition to the customizable graphic, we'll be creating an infographic with data points, a longer video on financial protection. You'll have the access to the Zoom backgrounds that you see here, WhatsApp icon, Twitter banner, the list goes on. So please stay tuned, sign up, use our resources, make them your own, and we look forward to seeing your campaigns. Thank you.
Excellent. So I will conclude this session by using the words of Laura Filido, a member of CSCM for UHC 2030 from Working Health, who says, such powerful speeches. Thank you to our amazing panelists. Thank you very much. And I'll now hand over to the co-chairs to conclude this session. So I won't have to come back. So whichever co-chair is speaking, also take us out and drop the mic for us. Thank you very much, everybody. Over to the co-chairs from me. Bye.
Magda Roballo is going to be providing the concluding comments.
Over to you, Magda.
Thank you, Gitai. Good afternoon, everyone. I'm coming at the last bit of this excellent webinar. Thank you so much for your participation. I was not able to join you on time. Technology failed me, but I'm happy that I could be here for the most important part of the discussions and the brilliant contributions from our panelists. So to conclude this excellent webinar, I would like really to thank our Coalition of Partnerships for UHC and Global Health Principles Group. Thank Harriet as well, and all of you for such a great discussions today. I heard health is wealth. You need to spend money to save money. Health is an investment, not a cost, and many other critical comments that were made throughout the webinar. As our speakers articulated, financial protection and removing the barriers individuals face in accessing health services and products is necessary to realize people's rights to health, make progress on the Sustainable Development Goals, boost economies, and strengthen equity and social cohesion. We heard that financial protection is necessary to guarantee access to health care without financial hardship. This in turn can make a difference to improve the health and well-being of women, of children, of adolescents, and of people that are facing the burden of malaria and HIVs, and increasingly the burden of diseases. We also that financial protection can ensure families do not need to choose in putting food on the table or sending to school and accessing and affording healthcare. Now it is up to all of us to urge our ministers of health, our ministers of finance, our parliamentarians, and other decision makers to take concrete and ambitious steps to all of us, especially the most vulnerable population groups and marginalized populations in financial hardship and impoverishing health costs. We encourage you all to start convening and planning your UHC Day campaign events and writing letters to your government officials as of today. The UHC Day campaign toolkits and the UHC Day advocacy letter templates are ready for you to use on the uhcday.org microsite. We're here to support you. We will also organize another advocacy letter writing workshop on the 17th of October. So watch out for that workshop. To borrow from the language of the Coalition of Partnerships, let's work together towards good health and well-being for all. Thank you so much for joining us and for all that you'll be doing to campaign for UHC and financial protection. Thank you. And I think I should now declare the webinar closed. Thank you.
Perfect. Thank you, Magda, and thank you everyone for joining us.
Thank you. Thank you. Bye-bye.
Thank you.
Thank you. Bye.